Hello and welcome to Newsmax Health on Newsmax TV. Right now we're talking with Dr. David Samadi, Chief of Robotics in Minimally Invasive Surgery at the Mount Sinai Medical Center in New York. Dr. Samadi is a leading prostate surgeon and a pioneer in the field of robotic prostatectomy. It's great to have you with us.
Good morning.
Now, it can't be easy to know that cancer is growing inside your body and do nothing about it. But an increasing number of men with early-stage prostate cancer are foregoing treatment and instead practicing something called watchful waiting, in which the malignancy is monitored but not treated unless it progresses. Now, Dr. David Samadi, we want to ask you, obviously you are a surgeon, but there are circumstances in which you are willing to help a patient practice this watchful waiting. Who are the candidates for this treatment, or rather lack of treatment?
As a surgeon, I can tell you that a lot of patients that come to the practice, they're seeking surgery because they want to get the cancer out. They don't want to deal with this prostate cancer day in and day out. We also know that staging, or knowing how much cancer you have in the prostate, the extent of the disease is very difficult with diagnostic tools and ultrasounds and biopsies that we have today. So most people want to get the cancer out because they don't want to deal with this anymore. What's important is the follow-up after surgery with a PSA has to be 0. So they will always know that they're cancer-free. And I only use radiation after surgery, which is a lot easier, because I think once you get radiation today, it's very difficult to do surgery after radiation. Now, there are different types of prostate cancers. There are some low risk, there are moderate, and some high risk. So most moderate and high risk prostate cancers, they choose to go for surgery because we get the cancer out, we will know how much cancer they have, the margins, the extension of the disease. Now, for low-risk prostate cancer, and those are what we call indolent prostate cancer, or Gleason 6, low volume, and those are the ones that we may opt to give them watchful waiting, or a better term would be active surveillance. What it really means is that the patient comes to our practice every 3 months, they would get a blood test, they would get a rectal exam, and you have to be very smart about this, because if you have 5 out of 12 cores positive with low-risk prostate cancer, that's not a good candidate for watchful waiting because he has too much disease. So typically, if you have small amount of Gleason 6 or low-risk prostate cancer with like few cores, those are the ones, and if the PSA hasn't really risen over the years, we would give them an option of active surveillance or watchful waiting. And then the discussion between them, the pros and cons, are very healthy discussion with the patients and their family members.
And then when you talk to these patients and you go through the very careful interview process, do you find that it's difficult psychologically for a man to go about his daily life knowing that there is a tumor inside of him?
Yeah, that's absolutely right, because what we have learned over the years is that some of these patients that have low-risk prostate cancer, after the prostate comes out, there's usually more cancer, and there's also more aggressive cancer, and that's what the data, 40% of the patients will have more disease. So when they understand that, and the concept of just walking around with the cancer and the psyche behind it, the emotional impact that it has on them occasionally could be problematic, and they really want the cancer out. At times, if they're older, if they have more medical issues, diabetes, high blood pressure, cardiac stents, they may not be good surgical candidates. And if we know that this cancer is not going to affect them, I may choose to watch them over the years and make sure we protect them with careful examination and tests. So those would be good candidates for this kind of watchful waiting.
Dr. David Samadi, Chief of Robotics in Minimally Invasive Surgery at the Mount Sinai Medical Center in New York. It's been great talking with you.
Thank you so much. Thank you.